Our next speaker in this session will be Anthony Duignan, and Anthony is going to be talking about the role of tuberculin assays on naturally infected cattle in the Irish Bovine Tuberculosis Eradication Programme. Thanks, Anthony.
Good morning, everybody, and first I want to give you a Céad Míle Fáilte Rómh go léir, 100,000 welcomes to Ireland. That's our Irish language. I've been asked to talk on the role of tuberculin assays in naturally infected cattle. The quality controls. What is a quality control? Well, quality control is it's a managerial process by which the performance of a good is compared to the actual desired performance of that goods or service. So are we getting what we want? Are we getting the quality we want? A lot of the literature on quality control comes from the automobile industry, and it really was written by Americans about Japanese production, and we all know what happened there. So anyway, in our Irish TB programme, we have a large part of my time is given to quality controls in various parts of our programme, and that would include the equipment used by our testing veterinarians, the tuberculins, our animal health computer systems, the surveillance at slaughter, are we getting what we're paying for, the laboratories, the applied research in Severa, the university. I've done a lot of work on personnel and field surveillance and quality controls on testers in the field. But for today I'm concentrating on the tuberculins. And is it really doing, like the quality control definition, is it doing what it says on the bottle? Here we see on the label, it's not Appalachian Control A or red and white wine. It's has it got the number of units of potency that we require. So as a testing vet in the field myself, I didn't care as long as it was a red bottle or a white bottle, but I've moved on. We use our tuberculins then as the essential tool in our comparative tuberculin test. The test itself is the principal means of detection of bovine tuberculosis in the live animal. And we also use the gamma interferon test in our programme, which also uses the same tuberculins as part of its test. These tests then, they use purified protein derivatives, and I'll try and explain what that is on the manufacture of bovine tuberculins. It's manufactured from culture and growth of the strain AN5, cultured in a synthetic medium, filtrated, acid precipitated, and then washed and resuspended many times until we get a dilution of about 1 milligram per ml. And then that's adjusted depending on the potency tests in guinea pigs in the laboratories. So it's quite a crude production system, but still quite refined when we look at the quality controls on the production. And in some of the literature, you could actually read into it that it was actually a witch's brew, because it's quite crude. The production is quite crude. And there are some photographs from the production line in Lelystad in Rotterdam, quite crude. The standardisation of tuberculins, then, why is it essential? Well, we want to ensure that we've gotten sufficient diagnostic strength to detect the largest number of infected animals as possible in our programme. And we also have to guarantee tests that are done for movements of animals between countries. Is country A using the same standard of tuberculin as country B? So there was a need then to have a standardisation of tuberculins. So the standardisation then is based on what we call potency. And the potency then is a measure of the tuberculin's activity in animals sensitized with a specific organism by comparison to a reference preparation. Now, the most reliable measure of a potency then is by assay in the species in which you're going to use it in the field. But that's kind of common sense. I'm going to skip through a lot of the production and the history of tuberculins. It's not part of this talk. So in the late 1980s, Dutch standard PPD was accepted as the international standard, and that had a potency of 32,500 units. One of the very important messages from my talk today is to underline to you that the current stocks of international standard of bovine PPD are extremely limited, and what's left is of extremely dubious quality. There are currently only 10 to 12 vials left of acceptable quality. If you look at the 2 vials that are there, this one looks reasonably okay, but the one on the right, it's denatured, just coloured, and that's about all that's left of the international standard. Luckily, in the early 1990s, the Dutch were kind enough to make an Irish standard, which was virtually the equivalent of the international standard. And each country who uses tuberculins in their eradication programs should have a stock of their national reference standard, which we do, and we have considerable amounts in stock. I think we have about 900 vials at the moment. So we're okay, but internationally, there is a scarcity of international standard, and the powers that be, whether it be WHO or OIE, will have to take the matter in hand and create a new international standard. The manufacture and composition of tuberculins, as I said, the label says Appellation Contrôlée, and that's because it has to fit with the European Pharmacopoeia, the OIE manual, and the EU directive. The potency requirement for bovine PPDs then, the EU minimum requirement is 20,000 international units, as specified in Directive 64432. The OIE recommends national campaigns should up to 50,000 international units, and our Irish requirements then are up to 30,000 international units. That's when tested in guinea pigs. However, the EU requirements, if we look at guinea pig assay of tuberculins, there is an allowance of 60 to 150% range. So the actual potency of the tuberculins, when looking at the EU minimum, could be down as low as 13,200. And if we were to go with the OIE requirements, it could be as high as 75,000. So there's a huge variation in the guinea pig assay ranges. So it's good practice to periodically check the accuracy of guinea pig potency assays by checking the product in cattle. So we use naturally infected cattle in Ireland. We're lucky that we have a facility in which to do so, and that we have a good supply of naturally infected cattle. Now, the recommendation to check tuberculins in cattle ceased in 2002. I think it was deliberately left out of a directive because most countries had eradicated TB, bovine TB, and no longer had a requirement to have their own tuberculin production, nor had they any requirement to have tuberculin testing. However, the OIE terrestrial manual of 2009 still recommends that the product be checked in naturally infected cattle. So it can be expensive. We have a facility, we're lucky enough to have it. Here we have just guinea pig assay. It's not a very clear picture, and a cattle assay picture. We'll deal with that a little bit later on. We have a central research laboratory on which we have a dedicated high security yard. Our tuberculins are chosen at random from our supply, and we also have checked tuberculins from other countries as collaborative cooperation. So we've compared the potency of tuberculin as estimated against the international standard or the Irish standard. Usually we use the Irish standard. That's the standard of known potency. So we compare what we're checking to what we need. It's not moving. What is? The licensing of our potency assays is strictly controlled by the Health Products Regulatory Authority. The animals are kept for scientific purposes, and they're subjected to the equivalent or more than the insertion of a needle. That's the definition. So we have to have project authorization, and we have to have individual authorization of our personnel. The selection of the animals, we select animals that are positive to the standard skin test, and they also have to have failed a gamma interferon test in the field from an infected herd before we accept them into our facility. We pick steers from 6 months to 2 years old, purely because they're easier to manage from dairy herds. They're quiet, they've got nice big necks, they've got nice thin skin, and they don't get too fat too quickly. We don't choose bulls because their skins are thick and they're hard to test and they're fractious. We have a minimum period then of 60-day intervals, either between assays or between previous skin tests in the field. We chose 3 bovine PPDs versus the Irish standard, and we dilute them at 1, their normal dilution, and then at 1 in 5. So we end up with 8 products, and we put them into our tuberculin syringes, number 1 to 8. Then we give 8 inoculations, 4 on each side of the animal, site 1, site 2, site 3, site 4. We rotate the tuberculin sequentially through each site, so there's no site bias. And we use 3 groups of 8 cattle, making a total of 24. The injection sites, like a normal tuberculin test, they're clipped, measured, and the animals injected intradermally. The animals are measured again at 72 hours. And the results are analysed using standard statistical methods, Finney's method, using a parallel line assay. Now, if you just look at some assay results here from 2012, just pick this one at random. This is batch number product of 2011, batch number 4, order number 4, run number 4, made in 2011 and checked in 2012, I think. Now, if we look at the potency in guinea pigs was 21,800, but remember what I said before about the guinea pig assay range from 65 to 150%. This could have a potency of 19,800 to 45,000. Now, the relationship between guinea pig assay and cattle assay is very inconsistent, as are the relationship between one assay on a batch of guinea pigs and the next assay of the same tuberculin on a different batch of guinea pigs. It's highly variable. However, when we check our guinea pig assays, what's routinely 30,000 in guinea pigs, we normally get 50,000 in our cattle. And as I said, for our Irish programme, the OIE recommends 50,000 international units. So we're quite happy to be getting 50,000 international units. And it's pretty consistent at the 30,000 or up to 30,000, given the judicial ranges, that we get 50,000. We, as an aside then, there's a lot of work being done by Eamon Gormley on using gametoferin-based potency assays. And the advantages of this would be using the same animal's blood many times, so that would be replacing live animals with test tube. We'd have less animals required, so we'd reduce the number of animals. Refinement, we wouldn't be injecting the animal 8 times, we'd just taking a blood test. Laboratory-based measurements can be better than field-based because we have less operator variability. And then we would also, because we'd be using less animals, we'd have a lot less individual animal variation, which is a problem in tuberculin testing. So the early work suggests, I'm not going into this because it's not published, but just to say that that will be the future of potency assays. If we just have a look here, we can see that the standard tuberculin, that's its parallel line, and then we see tuberculin A and tuberculin B. That the assay, the potency estimate is actually where it crosses the y-axis. So, and then just to mention as part of my talk that I haven't mentioned avian tuberculins because we don't do any work on them, and the reason we don't is because we don't need to, because the potency of avian tuberculins is very consistent, and the assays in guinea pigs is quite consistent from batch to batch too. So, my discussion then is that just to remember that bovine PPD is a poorly defined complex mixture containing over 100 individual components. It varies very widely in protein content and antigenic profile. And this gives inherent variability. And given that, it's therefore very important that standards are in place. And I also emphasize the scarcity of the international standard. There has been little progress in improving tuberculins and the improvement of specificity and test specificity and sensitivity therefore hasn't really improved over the years. But tuberculin itself is critical for test efficacy. Improvement of tuberculin PPDs, they would have the potential to enhance sensitivity and specificity of the skin test. So another Irish phrase here we have, Goramila Maha Guv Galir. Thank you very much, everybody.
Thanks, Anthony. We have time for one quick question. Yeah, just at the back there.
Thanks, Anthony. That was a really interesting talk. I'm Owen Ryan from the Department of Ag. I have a question about the reasons why you have lower quality. Is it because there's less protein, or is the protein more degraded in the batches with less efficacy? Or I know in other biological systems like that, with vaccines and things like that, people look for reasons why there might be lower efficacy, and it can be a degradation of the protein or a lower protein load, or one part of the protein isn't made up in the right way. Is anybody looking at correlates at a protein level with the batch, where some batches are of lower immunogenicity than others?
Owen, there's been mountains and mountains of literature published on tuberculin PPD production, tuberculin PPD quality controls, and it's just that there's such an inherent variability between batches. The production level is crude, the production method is crude, and the best means of standardization prior to potency assays is on crude protein content. I can get you loads and loads of literature.
Okay, thanks very much. Thanks so much again, Anthony.